Good evening and welcome to Iowa News and Views. Actually, good day. We are here in the Iowa State Capitol with Senator Michael Gronstal. We're here to visit about this just completed legislative session. We're actually sitting in the Senate chambers. Beautiful building, beautiful room. Thanks for being with us today, Mike.
It's a pleasure to be here.
Mike is the Democratic leader in the Iowa Senate, and we're here today to talk a little bit about the just completed legislative session and what some of the accomplishments were, what some of the disappointments were, and we're glad you're joining us for, as you know, viewers, Iowa News and Views, Iowa's longest running public access issues cable TV program. Mike, let's talk a little bit about the session. We got done last night about 9 o'clock. Today is, what, April 27th?
Mm-hmm.
And what would you describe some of the accomplishments of the session?
Well, there were certainly elements to this session where we had some pretty good successes. We were able to reform our long-term care system. That's basically our nursing homes in the state of Iowa. And Iowa's a little out of the norm when you compare us to other states. We have more of our senior citizens that need long-term care in nursing homes than the national average. We have about 2/3 of our people in nursing homes and about 1/3 in assisted living. And what this senior conversion plan will do is help alter that, help convert some of those long-term care beds to assisted living beds. It will also provide for significantly more community services in this state for senior citizens. So people will be more able to stay in their own homes. They won't need as high a level of care. They can be in assisted living beds rather than nursing home beds. It will long-term save the state money, but more important than that, it will give seniors a higher quality of life. It will give them more choices and more options in how they live out their golden years.
That is a huge initiative and one that's long overdue. And one also, I mean, there was a lot of bipartisan support that's been noted about that, but it's also a program that wouldn't have happened without the administrative leadership of the governor and his staff.
I think the governor has brought some great people into state government. The head of the Department of Human Services and the head of the Department of Elder Affairs put this plan together. We were able to partner with the federal government. We are going to get over $150 million from the federal government to make these conversions and to provide these expanded services. And it's really the creativity of some of the new people that Governor Vilsack has brought into state government. So I think we can all be proud of that accomplishment this session.
The other theme that runs through a number of pieces of legislation deal with the issue of bringing federal money into Iowa. This is a good example. Another one's the Water Quality Initiative.
Water Quality Initiative, last year the EPA identified 159 polluted waterways in the state of Iowa, streams and rivers and ponds and lakes in this state. And we were able to put together an effort with about $10 million in state dollars, draw down $65 million from the federal government to start to create buffer strips or filter strips, vegetation strips along those waterways to improve the quality of those waterways. Those filter strips help take chemicals out of the water as it moves through the soil to the rivers. They also help prevent erosion. So we're going to put, in the next 5 years, maybe as much as 500,000 acres of land in the state of Iowa along rivers and streams. We're going to put that into these buffer strips. It's a major initiative that's been really lacking for the last 25 years in this state. That was something Paul Johnson at the Department of Natural Resources was able to work with the federal government and come up with that. It's just a great program. And it's great to finally be moving forward instead of backwards when it comes to water pollution in this state.
It seems to me it's another example where we've known we've had an issue, much like the senior issues. We haven't done a very good job of funding the community-based system of service providers. We did this year with the governor's leadership. Water quality has been a huge issue for our state. We've not had really the consensus to do anything about it until Paul Johnson comes on the scene. The governor appoints Paul Johnson, of course, in the governor's leadership, and then we suddenly end up with this bipartisan support around water quality. It's an important time.
I think Governor Vilsack has really drawn the consensus together. I think everybody knew there was a problem. I think it took creative people in state government, took a lot of time and energy for them to approach all of the various groups that have an interest in this issue and come up with a plan that would work.
And that's what, about another $90 million worth of federal money coming into farmers' pockets to help improve water quality?
Yep, absolutely.
Another major initiative this session was the Millennium Fund, or the Vision Iowa Fund, establishing some resources for communities to develop attractions and basically more livable cities and towns in Iowa.
That was another effort that required bipartisan cooperation if it was going to happen. I guess the part of it that I personally am most excited about is that for the first time, and we have been talking about this since 1992 when we had a study of infrastructure needs in this state, we have a $3.5 billion problem with crumbling schools in this state, and we were able this year for the first time to put state resources into helping local school districts rebuild those crumbling, unsafe schools. And that's the part of it I'm the most excited about. I think we're disappointed that it couldn't be the $100 million that the governor recommended, but it is $50 million. It is a start to deal with those problems out there in this state. The state fire marshal says 36% of our school buildings have fire safety violations, and 10% of them serious enough that he would close those schools if he could. I think in a state that says they value education, it's just crucial that the state do something about that. We are one of only 10 states that doesn't help local school districts with their building needs, and we've now taken that step this year for the first time.
It would appear to be yet another major breakthrough. Just a short period of time ago, the majority party, the Republican Party, and their leaders basically said there was not a state role for fixing crumbling schools. And this year we've seen a flip on that for the good.
I think I remember some Republican leaders even saying that it would be over their dead body before we did this. Well, I'm proud we didn't have to kill them, but I'm proud we're finally dealing with the issue.
Sure. Senator Gronstal, another issue that was big on the agenda this year was the first year of the tobacco settlement money being available for investment in Iowa. We did quite a nice job, I think, in terms of,
you know, when we came into this session, there were about 150 different plans for spending that tobacco settlement money. It's about $55 million a year, and there were close to 150 different plans, one for every legislator in this institution. We were able to develop consensus inside our own caucus in cooperation with the governor that all of this money would go for health-related programs, and we made that commitment early on in this process, and eventually were able to convince the Republicans that that was the right thing to do with this money, that we were going to dedicate it all to helping people stop smoking and providing for the kinds of health care we need, expanding access to people. So I'm particularly proud of that as well. We're the first state in the union to dedicate their entire tobacco settlement to health-related needs.
Well, I think one of the realities that's coming home through the governor's administration is that if we're going to deal with our long-term health care issues in Iowa at every level of care, from birth to death, we need to take more control over that in Iowa, not really look to the federal government. Our hospitals in the state are struggling because federal balanced budgets are terrible.
Yep.
So we need to invest in our own health as a way to control our healthcare destiny, if you will.
But we were also able to direct a significant portion of those monies towards prevention. We don't want to addict the next generation of kids to nicotine in this state. So I think that's crucial too. It's really about transforming our healthcare effort to instead of treating disease, to preventing disease and promoting health. And so I think we were able to do that in a significant way this year.
The tobacco prevention money is principally focused on young people, youth access, and I hope that we're able to get back to that. One of my concerns was that we didn't have an adult cessation component, and I hope we can address that in the next year as we come back.
We will address that when we come back next year. I'm excited about our political opportunities. That's crucial that we make sure that people that are addicted have the kind of support and assistance they need to get off cigarettes.
We've talked about 4 issues: the long-term care initiative, the water quality initiative, the Vision Iowa, the tobacco, all very forward-thinking efforts on behalf of the administration, and certainly because they're such popular issues and important issues to Iowans, there was consensus here in the legislature. What things are you disappointed in as you look at what didn't get accomplished this session?
I could identify a host of disappointments, a host of things that had Democrats been in control we would have focused on. Probably top of that list would be in the area of some sort of assistance for senior citizens with prescription drug. It's a huge problem out there. Senior citizens spend 4 times what the rest of the population does on prescription drugs. I just read a report this morning. Pharmaceuticals, the 50 top pharmaceuticals that senior citizens use have increased at double the rate of inflation in the last year. And that's been a long-term trend. If you go back 15 years, they've increased double the rate of inflation. We are pricing many senior citizens out of the ability to take their prescription drugs, and some senior citizens cut their pills in half, take half the dose they need just to make it stretch long enough for them to be able to afford it. We made an effort this session, but the Republicans rejected it, an effort to help senior citizens with prescription drug costs. I think that's a very important thing that we would have done differently had Democrats controlled this institution.
Sure. Another issue out there was the whole issue of mental health parity and trying to address the problems of people that have mental health concerns as well as substance abuse. Actually, the governor offered a proposal that would basically require insurers of those kind of major medical plans to provide coverage to people. We didn't get very far with that this year.
You know, if we took organically based diseases, like if we took somebody with heart problems and said, our insurance policy isn't going to cover heart problems, or it isn't going to cover cancer problems, people would be absolutely outraged. What we have is a system that says if you have a mental health or a substance abuse health problem, that insurance policies won't cover it, or cover it at a much lower level than they do those other medical diseases. So the governor did propose an effort to require insurance companies to offer that kinds of coverage. The House watered down the governor's plan. When it got to the Senate Republicans wouldn't even pass the watered down version.
Another public safety issue that I know there was disappointment around was the whole issue of handgun and trigger locks being sold with every new handgun. That was a proposal of the governor that fell short.
There's broad public support for that. Every new handgun ought to be sold with a trigger lock. The Republicans rejected that effort, killed the bill in committee, rejected all amendments that were offered on the floor. It's really a common sense measure. It's not going to cause any difficulty for a person that wants to hunt or own guns. It's really no impediment to that. But if it could just save one life, a gun that somebody thinks they've gotten away from their kids in their home, and the kids, I mean, we hear every day about a kid in this country picking up a gun, not knowing it's loaded, or not even being old enough to understand how dangerous it is, and accidents happen, people get killed. If trigger locks could save one kid's life from and save a family that kind of tragedy, I think it's worth requiring that. I think it's another case of the Republicans basically caving into the special interest rather than dealing with the public interest.
You are watching Iowa News and Views. My name is Joe Balcom. I'm the host of the program. We're at about halfway point. We are here in the Senate chambers at the Iowa State Capitol. It's a beautiful building. We're here just got out of 2000 session yesterday. It is April 27th. I'm here with Democratic leader Senator Mike Gronstal from Council Bluffs. We're just talking about some of the issues that we've been working on. We're sitting at a desk in the back row here, and nice place.
Well, as you can see around the chamber, there's still a few people here cleaning off their desks, and most people cleaned off their stuff yesterday. You can see here's where we vote. These are our microphones. If you want to speak, you hit one button. If you're voting yes or no, you hit the green and the red button. Or if you have a conflict of interest, sometimes you vote present. These are the desks we sit at every day, and in fact, for most senators, these are in fact our offices. There aren't offices in the building for every senator. So this is where, for the folks watching this, your state senator comes up here, and this is essentially their office during the session.
Good description of that, Senator Gronstal. We also have a web page you might want to check out, pobox.com at iNews. And also, get that, Rusty, thank you. And check out our site. You can learn about the show, what's coming up. And also, if you've got ideas for guests or comments about the show, or if you want to be a guest, send us an email, we'll get you on, because we like getting email, and we appreciate all the many emails we get about the show. Back to the session, Senator Gronstal, we had a few disappointments. We've noted a few. One of the additional disappointments out there was the whole issue of patients being able to get their needs met through the court system, the legal system, if they're denied coverage by their HMO.
If a doctor neglects to give you appropriate treatment, you can take him to court and sue him for malpractice. If an HMO denies you treatment that's needed, you can't sue the HMO. They're exempt from that. We put together a common sense proposal that would have allowed patients to sue their HMOs, very similar to a plan that became law in Texas under Governor Bush in Texas. It hasn't caused any significant problems in Texas. People say there will be a zillion lawsuits filed and all of that. Well, in the last 2 years, there's been 6 in Texas, 6 cases of people being sued. This is a mechanism that would force the insurance companies to be a lot more careful about their decisions in managed care situations. They'd have to be much more careful about not denying people treatment that's needed. And it's something we should have passed this session. We offered it as amendments to a variety of insurance bills that were before the legislature this year, and the Senate Republicans refused to even debate them.
There seems to be a fairly significant philosophical difference between Governor Vilsack's administration and the majority party Republicans. The governor, I think, and Democrats in both the House and Senate see the important role for state government in improving the quality of life of Iowans, whether it's the tobacco issue, taking care of seniors, environment. There's a role for us to play to develop maybe activist is too strong a word here, as compared to the majority party, the Republicans, who really see the role of government as just kind of standing on the sidelines, staying out of the way, not really thoughtful about our future to the degree to which we Democrats, I think, are. What's your sense about the future on those two competing philosophies?
I think unfortunately it's even worse than that. I think it's that the governor tried to put together an agenda that speaks to the broad public interest in Iowa, and I think in those cases where we could draw the Republicans to the bargaining table, even if it was kicking and screaming, we were able to accomplish some things for the public interest. In the case of a lot of these issues we're talking about, it was the special interests that won. The special interests insurance companies that don't want us to hold them accountable for the decisions they make. Trigger locks, the NRA. It was the special interests that won with the Republicans, and I think that's pretty unfortunate. That's the biggest philosophical difference I see. We've tried to pursue the broad public interest, and they have responded to the special interests.
One of the other final issues of disappointment was some of the higher education proposals.
Huge disappointment.
Community colleges were underfunded by about $3 million less than the governor suggested. The regents took significant cuts as well.
Regents essentially have a flat budget. It's the worst year for state universities in my 18 years in the legislature in terms of what the legislature was able to allocate to them. We fought tooth and nail on those issues. I think, in essence, in the end, the Republicans balanced this budget on the backs of students. We even had a senator on the floor suggest that education's a privilege, not a right. And I think that is the difference between Democrats and Republicans. We want to make sure all students have access to higher education. We want every kid to reach their fullest potential. And it's not just kids. We need to have strong community colleges so that people can get trained and retrained. And they significantly underfunded both community colleges and Regents institutions in this state.
As the session closed, it wasn't but a few hours later that the press in Des Moines is turned their focus to the November elections and what's going to happen next because of these differences of opinion on these issues. Why should Iowans give Democrats control of the state house this coming fall? What would be in your mind, the top few reasons for that?
Because I think we will go back to the public interest. I think we'll pass a prescription drug benefit for senior citizens. I think we will reinvest in higher education in this state to make sure every kid can reach their full potential. We'll hold insurance companies accountable for the decisions they make. We will move this state forward. I think we are well positioned to do that. We have had the best recruitment year in terms of candidates that we have ever had. People are excited about this new governor. People see Tom Vilsack as a guy that's willing to take us into the future as opposed to the Republicans that keep looking back. So we've had a great recruitment effort. There's 17 Republicans defending seats. There are only 8 Democrats, so we got to be more on offense than we do in many years. So I think we're going to have a great fall talking about issues that are important to Iowans.
So in those races that are going to be going on around the state, what makes for a good candidate in a district? You certainly got the issues, you've got the candidate.
We go out and look for candidates that are well connected to their districts, involved in their communities, people that have participated in the community life in a variety of different ways, and that's the kinds of candidates we've recruited this time. Smart people, people committed to the future of Iowa, and it's just been a very good year for recruitment, so we're pretty excited about those opportunities.
Mm-hmm. Are there any particular issues you think are going to stand out this fall?
It really sounds to me like, based on the education votes we took this session, that education is a clear difference between Democrats and Republicans. We are much more committed to having a strong educational system in this state. I think teacher salaries may become a significant issue. We're losing many of our better teachers to other states. We're going to have to make significant investment there to improve teacher salaries. And then there are a host of other issues, maybe even too many to
Sure.
go through.
Sure. So you're running this fall?
I'm running this fall. I represent a district that includes Council Bluffs and Carter Lake on the western edge of Iowa, and I'm up for election this fall. Be door knocking this summer and
Doing
working
all the
hard
things
on the
that
campaign.
campaigns do.
Yep.
Door knocking, raising
Yep.
money,
Yep.
getting your message out there. That's all very good. Well, I think we have a terrific opportunity ahead of us this year to bring some more Democrats in the legislature and in both the House and the Senate. The House is, 56 Republicans, 44 Democrats.
That's
They've
right.
also had a very strong recruiting season and taking the same messages to their districts. That's good.
We've worked very closely with the House and with the governor to develop agendas this session, issues that we want to pursue. And like we said at the start of the program, we had some success with those. But there are a lot of issues that were left on the table, and we'll be campaigning on many of those issues this fall in cooperation with the governor and with the House candidates, and in cooperation with our presidential candidate. I think Al Gore is going to be on similar messages and themes, so really pretty excited about this election.
The majority party, the Republicans, they've already kind of been laying out kind of their agenda. It's about, it continues to be about tax cuts and actually saying that they have to be here to prevent the governor from spending more money than we should.
Actually, that's the Republicans love to say that. It was Democrats in 1992 that tore up the state's credit cards and got us out of debt. Democratic legislature, not a Republican legislature. We've created a law that provides for the state cannot spend more than 99% of its revenues. We've got a balanced budget. The Republicans want to try and scare people about that, and it's really pretty silly.
Well, I think that the Iowans have other priorities on their minds. I mean, tax cuts are certainly important, but there are also those tax dollars to be invested in our futures. I think this session was largely about that.
Yeah, it was. It was about building an Iowa that's got the strongest education system possible. It's about building a state that's got clean water, good health care, and that's going to continue to be our priorities.
Great. Senator Gronstal, thank you for being with us. I hope that this is a strong year for us and that we'll be calling you Majority Leader Gronstal come January 2001. I appreciate all your hard work on behalf of your constituents and Iowans.
Thank you.
Thanks for being with us.
Me.
You've been watching Iowa News and Views. My name's Joe Bulk. I'm host of the show. I also actually need a disclaimer here. I'm also a member of the Iowa Senate. I represent Iowa City and Johnson County, if you didn't already know that. I'd like to thank Rusty Martin, our director, for today's show. And remember, this is just a TV show. And what's important is what you do each and every day in your community to make a better place to live. Senator Gronstal's working hard every day. It's your turn now. We'll see you next time.